Tiffany's holding up a photo of herself about 3 years ago. Tiffany, let's see how you look today. Tiffany, what made you decide to have a facelift?
I started noticing that my eyes droops a lot, and I got bags under my eyes, my neck, lots of wrinkles, and a lot of fat under my chin. And people start treating me like an older person.
What happened?
Well, they start calling me ma'am and madam, and even the men greet me as man and madam, and I didn't like that.
So what did you do?
So I started to do some research to look younger, and I tried Botox and filler for a few years, but it did not work as well when I start getting a little bit older. So I'm looking for something more permanent, like a facelift. I did lots of research, online, offline. I read everywhere. I try to find the best doctor because I have seen a lot of people that had bad jobs done, and I'm really careful about who do surgery on me.
So how did you find Dr. Doss?
I found him online, then I decided to make an appointment to meet him in person. And I had a consultation with Dr. Dash, and I felt very, very comfortable with him immediately. I felt like he was very gentle and very caring, and I fully trusted him. I feel very comfortable and very happy that I found him.
Well, Dr. Doss, those are very nice compliments. How do you determine the best course of action when determining considering a facelift for a patient?
Well, Tiffany's got a typical story. Most people notice signs of aging in the eyes and the neck. So those are the two areas we really have to address really well. So in order to address the neck and the jowls, we reposition the tissue back to a more youthful position. And then that's our typical facelift. And I try to get the most natural vector so the results are beautiful. And then we address the eyes through the upper and lower eyelids, and sometimes a brow lift. And that's what we did in this case.
And what are the most important factors to consider when planning the facelift?
I think the most important thing is to individualize the treatment so that we address everything that the patient is concerned about, and also create a balanced result so the result is very natural appearing.
Well, Tiffany, you look beautiful. I don't think anyone's going to be calling you madam any longer.
Not anymore. I'm so happy with the result. I look very, very natural. At first 3 days after the surgery, I was already happy, even with all the swelling and everything. And my boyfriend, he didn't even notice that I have a facelift lung because I didn't tell him. He just like, amazing, you're so beautiful, but he didn't know what I had a facelift.
You just had a vacation.
Yes, I did. Thank you, Dr. Dass.